Hi. So we're going to talk about the basic skin infestations. Okay, that's scabies and pediculosis. Okay, a 6-month-old infant has itchy erythematous papules and exudative lesions on the scalp, face, groins, and axilla for 1 month. She also has vesicular lesions on the palms. The most likely diagnosis is congenital syphilis, seborrheic dermatitis, scabies, or psoriasis. So the answer here, in an infant with itchy red papules and oozing lesions on face, scalp, and the folds of the body with vesicles on the palms is scabies. So in scabies, important point is the circle of Hebra, that is the distribution of the scabies rash on the body. The lesion in scabies is classically called an excoriated papule. Right? Papule is a primary lesion, but here you see mainly excoriated papules. What is pathognomonic in scabies is the burrow, that is the lesion created by the mite into the skin. But you don't really see the burrows, you can see the excoriated papules. The circle of Hebra is shown here in the blue circle. It involves the sites where the scabies mite can be found. That's the axilla to the elbow folds, the wrist flexors, the web spaces of the fingers, the umbilicus, the genitalia, buttocks folds, the thighs, and the flexors of the knee, as well as the ankles. In infants, a very important feature, the face, the cheeks can be involved, and the palms and soles also, because the skin is very thin in infants. And in infants, you will have vesicles. In adults, they are already excoriated. So scabies is caused by Sarcoptes scabi var hominis, that is a mite. All right. So here you can see a figure of the mite. It's got a round body and it has 4 pairs of legs. This is like a ventral view of the mite. It's flattened on a slide, and you can see the mouth parts, the biting mouth parts in front. Okay, it's transmitted directly from person to person and by sharing personal items and bed material. The main symptom is the itch, which gets worse at night because that is when, in the warmth at night, when the mites come out onto the body surface. And another symptom would be secondary eczematization of these lesions, and commonly you have secondary infection, bacterial infection as well. So you'll have some pustules. An important point in scabies is nodular scabies. Now, nodular scabies is a hypersensitivity reaction of the mite. Okay, so this usually occurs on the scrotum where the skin is thin, and that hypersensitivity reaction to the mite body parts causes these thick and very pruritic, very itchy nodules, which persist long after even scabies has been treated. So that's also called gentleman scabies. Okay, crusted or Norwegian scabies is a rare type of scabies in which you have infestation by millions of mites on a person's body. Normally, you may have maybe 12 or 13 adult mites on the body, but here you have millions. And this is seen in immunocompromised patients or someone with, say, severe diabetic neuropathy when there's loss of sensation, or someone with, with cancer which is quite advanced. So that immunocompromised state causes thick, scaly crusts to form on the body. The diagnosis of scabies is typically by demonstration of the mite. That is done when you scrape between the web spaces and you mount it on a KOH mount, potassium hydroxide stain. You will be able to see the mites. Or if you can demonstrate the burrow with a drop of ink between the web spaces, you may be able to see that linear burrow, okay, of the scabies mite. Treatment, most important, most commonly used treatment is permethrin 5%, which comes in a cream form. Okay, other less commonly used drugs are gamma benzene hexachloride 1%, benzyl benzoate 25%, and crotamycin 10%. Oral medication is ivermectin, which is ovicidal. That means it kills the eggs as well. So this is also important in scabies treatment. However, ivermectin is usually avoided in children, in pregnant patients, and in the elderly as well. So in pregnancy, the safe drug would be permethrin 5% cream or a sulfur 6% lotion. Typically, the permethrin or any of the topical medications, treatment is repeated after a week to 10 days because of reinfestation with new mites hatching out from the eggs after the first treatment. So, retreatment is given a week to 10 days later with topicals, and oral ivermectin is also given at times to ensure the ovicidal action. So we're looking at the other options in that question. What are the lesions in congenital syphilis? The lesions will be seen in the perinatal period, okay? And these lesions are similar to secondary syphilis. So you can see bullous lesions in the infant, which may occur on the palms or soles, even on the trunk. There may be erythematous patches. Fissures are important, perioral fissures as well as anal fissures. This classical snuffles and ragads. Ragads means the perioral fissures, snuffles means there will be basically a rhinitis. There's also hepatosplenomegaly and generalized lymphadenopathy. Okay, seborrheic dermatitis in an infant. It's also known as cradle cap when it affects the scalp on an infant. So you have yellowish greasy scales which overlie an erythematous base on the scalp. These can affect, of course, the hair-bearing areas of the face besides the scalp, the nasal folds, and in adults it can affect the V of the chest as well. Psoriasis. So psoriasis is characterized by thick micaceous plaques. Micaceous means these silvery white scales. Distribution is usually on the extensor aspects, not on the flexor aspects. Okay, and Auspitz sign is a sign that is demonstrated in psoriasis. In infants, palmoplantar psoriasis is uncommon, though in adults, of course, you can have lesions on palms and soles, but those lesions are plaques, they're not vesicles. Okay. Macular cerulear is seen in pediculosis humanus corporis, pediculosis capitis, scabies, or lupus erythematosus. The answer is pediculosis corporis. So pediculosis is also known as vagabond's disease. It's caused by a louse, an ectoparasite, and you have different types of pediculosis. Pediculosis capitis is found on the hair shafts. Pediculosis corporis is found on the body hair, and Thyrus pubis, that is the crab louse, is found specifically on the pubic hair and on the eyelashes. Okay, it's because of the diameter and the different circumference and the characteristics of each hair of the body part that you find these different lice. The clinical features is the nocturnal itch, again is more in the body folds where is the louse inhabits. And the itch is also due to the hypersensitivity reaction of the body to the louse saliva. Macula caerulea, which is known as blue spot. So this is basically the blue spots which you may see on the trunk, which are like bruises after louse bite. Okay, on the scalp, the head louse will usually reside at the back of the scalp, the occiput, which is nice and warm, right, in the occipital pit, and close to the hair roots, right, so that it can come down and take a blood meal from the skin of the scalp. The eggs, the nits, are found usually on the hair shaft, and they're usually eccentrically placed. That means they're stuck onto one side. Okay. The symptoms in head louse infestation, very obviously, is an itch on the scalp, and it can go down till the back of the neck. You may even get an eczema on the back of the neck, okay, because again, reaction to the louse. Complications, secondary bacterial infection, occipital lymphadenopathy, and plica polonica, which is basically a tangling of all the hair and matting of the hair. It's usually in unkempt people, secondary to severe louse infestation. Treatment for pediculosis capitis is permethrin 1% lotion. It's used like a 30-minute leave on and then rinse off, repeated again after 1 week to kill the new lice which would have hatched from the eggs. Manual removal of these egg cases is also very important, of course, to prevent reinfestation. And ironing out the clothes with a hot iron is important because these body louse can also stay in the folds of and then they attach onto the clothes. Okay, other treatment options, topicals, are malathion and lindane. Drug of choice for Norwegian scabies is permethrin lindane 1%, oral ivermectin, or sulfur 6%. So in Norwegian scabies, as I said, there is immensely thick scaly plaques all over the body. So the penetration of a topical treatment may not be ideal. So uh, permethrin would probably be given anyway. But in addition, oral ivermectin, which can kill both the mite as well as the ova, would be ideal for treatment.